All right. Why did that go off? What is going on here? Drop frames. Okay, so just make sure that the audio and video are working. I'll move the camera over onto the body. Let's see here. All right, let's get him uncovered, and then we'll pick up from where we left off. All right, cool. Yeah, I see a couple people let me know why is this coming up with an error, and then turning this off on me. Okay, well, something is going on. Seems. All right, well, whatever. I don't know. YouTube's giving me an error, but it seems to be fine. All right, let's get this uncovered here. Whoops. Try not to trip over cords. All right. So I think we're going to start with just a little bit of osteology. So we can just get some of that out of the way, and we're going to correspond. We're going to look at some bones. I'm going to put them down in relation to the body here. We'll go over some of the parts, and then we'll correspond to where you can find those things on the body, and then we'll go through all of the back muscles. So we're going to completely finish the back and all the muscles that we can see back here, all the movements and everything. And that's kind of where we'll stop for today, because to move on to the next part, we're going to have to flip the body over. So we'll get done with the entire back today. Then we're going to move next week, or not next week. Whenever I say that, I mean next lab, because normally during a fall and spring, it would be next week, but for here, it'll be on Wednesday. So when we get to Wednesday, we'll have the body face up, and we'll be doing going up around the top of the skull to the face, the anterior neck, and down towards the thoracic muscles. So we'll kind of wrap around the anterior side. So we're going to get all the posterior side stuff done today while the body's face down. All right. Now, let me just get some of this set here. And sorry, just got to wipe up a little bit here. Stuff in the way here. All right, get that out of the way. Grab my tools here. And all right, I think we'll be good. So let's move up a little bit. Something like this, I think. Sorry, just takes me a second to get things positioned correctly. Sorry, one more second. There we go. So to get out a little bit more. That's better. All right. So let's grab the scapula. We'll kind of start here. So you see, I'm going to kind of lay the scapula over where it is here. Now, unfortunately, my assistant is not here. I'm not sure what happened with him. He's supposed to be here. So again, I'm going to be monitoring the chat. So if you guys have something posted up, I will address it. He might come a little later, and if he does, he'll just jump in and he can start chatting it up on there, so I apologize, but I do have one eye on the chat. So if you have something, just interrupt me, post it up, and I'll address it. All right. So this is how the scapula sits here. And again, just to reorient you guys, here's the midline of the body. So there's the spine, right? We got the head up here. You can see the shoulder here. Here's the back of the shoulder blade, right? We're going down more inferiorly. So superior, inferior, medial, lateral. Again, male cadaver, he's face down, and I'm standing on the left side of the cadaver, so I'm looking in on the left. All right. So we got the scapula here, and once we have it oriented like this, right, we can see here's the superior side of the scapula. There's the inferior side. This is the medial border of the scapula here. Okay. This is the lateral border of the scapula over there, so we can position it. And again, when I ask you questions, say if I was going to ask you parts of the scapula here and I was going to use one of the bones, I would orient it to the body. So I would let you know where we are and what side's what. All right. So what you're looking at here is the posterior side of the scapula. If we turn it over, this would be the anterior side of the scapula. How can you tell? The anterior side of the scapula is completely smooth here. See, no features really. And we go to the posterior side and we have this big bony ridge sticking out here, and that's going to be the spine of the scapula. So let's correspond some of this stuff. As you can see here, we said that was the medial border. You can see my fingers on the medial border of the scapula there, right? The lateral border is going up over here. Now we have a muscle. See this muscle I'm grabbing right here is attached right along the lateral border of the scapula. So that lateral border is like right here, right? We can push our fingers in and kind of palpate. See, my finger's like right up against it there, but there's a muscle covering it. Okay, and then here we got that spine of the scapula, and that's going to be right along here. Okay, so this here is going to be right up along there, like that. So it's kind of like this. Right, so here's that spine of the scapula. Now, if we follow the spine of the scapula out, you see it there's like a diving board here. You guys see this part sticking out here. It looks like a diving board. That's called the acromion process. So that's at the end of the spine. So we follow the spine of the scapula out. We'll feel this corner right here. We'll feel like an edge. And then we have that diving board sticking out, which is the acromion process. And that's going to be here, right? So I'm going to palpate the spine, palpate all the way out until I feel this corner right there. And then this part that my finger is on top of there is on top of that diving board there. So we got the spine coming over to that little corner there. We'll return to the acromion process. And again, that's going to be like me coming out here until I get to that corner, and then my finger is on top there, on top of that acromion. Ah, here's Alex. Hold on one second. Hey, how you doing? All right, you can just turn that back around. I was just trying to watch a little bit, see if anything popped up. Yeah, no problem. All right, so Alex is here, so if you guys do have questions, post it up. He's there. He'll be monitoring it. He's going to be posting up some terms and everything as we go through. So for today, don't even worry about like posting up the pictures. I didn't load them up because I wasn't sure, so I was like, I'm not going to bother because, so let's just type up terms.
Sure.
All right, so I'm just doing parts of the scapula right now, and then we'll just kind of go from there. So just jump in and that's all from last time. I didn't even change it, so don't worry about it. Okay. So we got those couple parts. Now, those are all parts that we can palpate here. There are two more parts that we're going to talk about today, and I'm going to mention them now. We'll re-mention them when we get back to talking about movements of the scapula. But if we follow the medial border of the scapula all the way up to the very top, right here, okay, that is going to be called the superior angle of the scapula. So it's at the uppermost part of the medial border is the superior angle, all right? And then if we follow the lateral border all the way down to the bottom, right here, that's the inferior angle of the scapula. So it's the lowermost part of the lateral border, right? So I'm going to grab the inferior border, and I'm going to grab the superior, inferior angle and superior angle here, right? That's where my fingers are on, superior angle, inferior angle. We're going to reference these points later on when we talk about a different movement that the scapula can do. Because remember, if we kind of think back to last lab, we talked about the trapezius and trapezius acting on the scapula, and we said the scapula could move up and down, That was elevation and depression, and the scapula could move medially and laterally, and that was retraction and protraction, right? And we're going to talk about those movements again because we're going to see other muscles that can do that stuff. But the scapula can also rotate like this. It can turn, okay? And we'll get to that, but that is going to have to do with these angles moving, okay? So we'll get back to that rotation. All right, so those are parts of the scapula that we can kind of see. And if we were going to palpate, like up here, if we follow that medial border up to the top, my finger's on the superior angle up here, and if I follow that lateral border down to the bottom, here my finger's on the inferior angle of the scapula, so superior angle, inferior angle, right? And then you can see that I can move the scapula around a little bit. That's retraction, that's protraction, that's elevation, that's depression, okay? All right, perfect. So last time we did trapezius, we talked about the movements that trapezius can do, right? So what we're going to do is take trapezius and we're going to reflect it out of the way. And we're going to go to muscles that are deep to trapezius, right? So we're going to take this guy, we're going to reflect it out of the way. And the next muscle we uncover here are going to be your rhomboids, okay? And there are two rhomboid muscles. We have rhomboid major and rhomboid minor. And they're side by side. They attach to essentially the same things, and they have the same movements, right? So when we have two muscles that are parallel to each other, attaching to similar things with similar movements, then we say that their relationship is synergistics. Remember, we talked about those muscle classifications last time. I'm sorry, not muscle classifications, movement classifications last time, right? And one of those things was synergist, right? So rhomboid major and minor are going to be synergistic muscles. So what we're going to do is kind of grab this whole thing here, all right? You see this thing that I'm moving here? This is both rhomboid major and rhomboid minor. And you see this little break right there, okay? And you can kind of imagine, listen to the name, rhomboid major. Major makes you think that it's larger, and minor is smaller, right? So you can see this bigger part here, the more inferior part, that's all rhomboid major. And then this little part that I'm moving here, you can see that little separation, that's rhomboid minor. But notice how I only separated it a little bit, but here you see that they're still kind of stuck together. And that is kind of how it was. I made this separation in the muscle, but really they are kind of stuck together like that. And that's usually how you see it, where they kind of be stuck. So if they weren't separated, I would have you identify it this way, right? I'd say identify. I'd say we have two muscles here, right? Holding this, I'd say we have two muscles. I want you to identify this one, or I want you to identify that one up there, right? So that way visually you can see, okay, this is the bigger part of it. That's the smaller part of it. This would be rhomboid major. That'd be rhomboid minor. All right. When we're going over this muscle here, we want to think about what it's attached to, right? That's how you're going to determine the movement. So just note that on the practicals, I'm not going to ask you for specific attachment points, but it does help to it, even if you can't say the absolute like specific attachment point, in general, to be able to look at the muscle and just kind of follow it to both ends and go, oh, I see, if we follow rhomboids over this way, right, we run into the spine, into the vertebrae. And if we follow rhomboids over this way, we run into the medial border of the scapula. So those are its two attachment points. Spine, right, over to the medial border of the scapula. We're going to connect those two things. And if you know the two attachment points, then understanding the movements is going to be a lot easier. It's much better for you guys, again, not to memorize the movements if possible. It's better to look at the muscle, look and see, follow it out to its attachment points and see what it's connected to, and then think about what movements are possible, right? So we can see that the rhomboid muscles here are oriented this way, right? So the line of action is going like this. We're connecting these 2 points, right? So again, we have to decide which of these 2 points is more movable. Is the scapula or the spine more movable? And we said last time that when you're choosing, the scapula is the most movable thing you have. So we're going to show this movement like this, right? That we're going to grab the scapula and we're going to pull the scapula over towards the spine this way, right? And we said that movement, again, I'll put the bone on here, going like this is retraction, right? And remember that was something that trapezius did, right? That was the horizontal component of all the different parts of trapezius, was retraction of the scapula. So rhomboid major and minor, right? These two, their function, retraction of the scapula. And since those fibers are in a horizontal plane, in a primary plane, that's all that it does. All right? So we got those two there. I guess let me grab a vertebrae, because let's just talk about a couple of the parts of vertebrae, since I'm going to be referencing them. Here we go. Real quick. All right. So we got a vertebrae here, right? And the way we're looking at the spine, the vertebrae are like this. All right. Let's just move over just a touch here, so we can see the spine a little bit better. There we go. So the vertebrae are kind of sitting like this. So these points, sorry, the camera's a little shaky. This ridge that my finger's running along there is these points sticking up, which are spinous processes, right? So right here, if I run my finger down, you guys can do the same thing. Reach around behind your back, right? And why is it doing that? The focus should be auto. I don't know what. Yeah, I don't know why it was just doing that. That's weird. All right. If you guys reach around to the middle of your back and just kind of run your finger up and down the middle of your back, you feel all those bumps, right? Each one of those bumps is an individual spinous process of one of your vertebrae, right? So that means that rhomboids here are attached along spinous processes of your upper thoracic vertebrae, right here, okay? And again, we go from the spinous processes over to the medial border of the scapula. So right now, that's about the only part of the spine that we can feel is the spinous process. We can see the rest of the vertebrae here. We got this large part, that's the body of the vertebrae, but that we won't be able to palpate until we're inside the body. So when we get, like, say, inside the thoracic cavity or the abdominal cavity, and we get behind all the organs and we push against the spine from the inside, we'd be pushing up against the bodies of the vertebrae. So we'll be able to see and palpate that later on. But from the outside, only spot you can palpate is this, that spinous process. Now notice if we look at it like this, we also have these processes sticking out to the side. Those are transverse processes. So they would be like down in here, but a little bit deeper, all right? So we won't be able to see those, right? But a little bit later on, we should be able to palpate some of these spots, all right? But again, they're going to be on either side here. All right, so spinous processes here, transverse processes on the side, and that's going to serve as attachment points for a bunch of the muscles that we're going to go over. All right, so let's take rhomboid major and minor and reflect those. All right, so let's get those guys out of the way like that. And we're going to come down here, and we're going to also reflect that latissimus dorsi muscle that we talked about last time. Right, so we're just going to take latissimus dorsi, get that out of the way. And I'm just going to move a little bit here. Actually, I lied. Let's put the rhomboids back. I forgot we're going to do a different muscle first. All right, so we've reflected trapezius. So we got trapezius out of the way. We just put rhomboid major and minor back. Next muscle we want to talk about is levator scapulae. Levator scapulae, all right? And that muscle, as the name kind of suggests, is going to do elevation of the scapula. So you look at the name, levator scapulae tells you elevation of the scapula. In order to see this muscle well, I'm going to take the scapula and I'm just going to pull it down. And look right here. Look at this muscle that kind of, see that muscle gets stretched out when I move the scapula down, right? That's levator scapulae. So let me just grab the forceps, kind of grab this guy right here. See this muscle that I'm moving right in there? That's levator scapulae. So this muscle is attached to the superior angle of the scapula, and it goes up, 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 and it attaches to transverse processes of some of your cervical vertebrae. All right, so the side of your neck down to the superior angle of the scapula. And when this muscle contracts, right, we can see it's oriented pretty much vertically. See, up and down. And when it contracts, it's going to pull like this. And that is going to cause the scapula. Again, I'll just put our bone that we can move here. So you can see levator scapulae when it pulls, like this. All right, contracts, and it moves the scapula up, which will be elevation of the scapula. That'd be levator scapulae. All right. Now, remember I said that there was another movement that the scapula can do. We said it can rotate, right? Now that we've done trapezius last time, and we just did levator scapulae, now we can talk about the rotation that happens when we rotate the scapula. And what you want to note is that if we're looking at the scapula here, right? The scapula can rotate this way, and it can rotate this way. And what you want to note is which way are the angles of the scapula moving, right? So whichever angle moves medially, it's that type of rotation. So if I go like this, if I turn the scapula this way, notice that the superior angle is moving medially, right? If I start here and I end there, start here, end there. We see the superior angle of the scapula moving medially. That's going to be superior rotation of the scapula. If I go the other way, and I go start here and I go this way, start here, end there. Now we see the inferior angle of the scapula moving medially towards the spine, right? That's going to be inferior rotation of the scapula, which again is start here, end there, right? So I'm put the scapula in its neutral position like this, and this would be superior rotation of the scapula, and this would be inferior rotation of the scapula, right? So it can turn this way, and if I'm grabbing the angles, we can clearly see superior angle moving medially, inferior angle moving medially, superior rotation, inferior rotation, okay? Now that we got that, if we look at these muscles, and let's start with levator scapulae, and I'm just going to move the camera out just a little wider. That's good. And what we want to see is that if we put the scapula down, we see levator scapulae, right? When it elevates the scapula, it's only pulling on the superior angle of the scapula. So it's not lifting the scapula from the middle, right? If it was attached here in the middle and it pulled up on the scapula would just elevate and nothing else, right? But since we're lifting the scapula by only pulling on the medial side, it's only going to lift the medial side of the scapula. And watch what happens when I do that, right? If I just pull on this part of the scapula, look at what happens. We do elevate the scapula, right? But we turn it at the same time, okay? So you see, as levator scapulae, as this muscle here elevates the scapula, it does inferior rotation of the scapula as well. It does both of those things at the same time, elevation and inferior rotation, okay? And we can't separate those two things. Levator scapulae contracts, it does both of those things. Look at what happens with trapezius, though. All right, let's put trapezius back. And let's specifically look at the superior head of trapezius, this part of it up here. And that was the part that pulled this way, right? And we said that that's a combination of these two movements, elevation of the scapula, retraction of the scapula, right? Those two things together is what superior head of trapezius does. Now, if we follow these superior fibers, look, I'm going to trace them down. Trace, 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 all the way down. Where do I end up? Way over here on the lateral side of the scapula near that acromion process, right? So again, let's just put the scapula down in place like this. And if we follow the fibers from the superior head down, 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 we end up over here. You guys see that? Right? We end up here. Now, if superior head of trapezius is going to elevate the scapula, but it's only going to elevate the lateral side of the scapula, what happens? So I'm going to pull up here. Look at that. We get elevation and superior rotation of the scapula. Right? We get elevation, see, like that, and superior rotation of the scapula. All right, so we said that levator scapulae is going to do elevation and inferior rotation, and superior head of trapezius is going to do elevation and superior rotation. And that's just because these two muscles attach to opposite sides of the scapula. One pulls up on this side, and the other pulls up on that side. See the difference there? And by pulling up on those sides, we get those two rotations. All right. Now, what happens when levator scapulae and superior head of trapezius contract at the same time, right? Well, we go, well, levator scapulae does elevation and inferior rotation. Superior head of trapezius does elevation and superior rotation. And the elevations, they're additive, right? They help each other. So if we're talking about elevation, those two muscles are synergistic. But the rotations, right, they're opposite. So when they try to happen at the same time, we get a neutralization. All right? So that's a nice, simple neutralization that occurs when you shrug your shoulders up. So when you elevate your shoulders, right, your scapulae go just straight up like this. Why? Because the two muscles that cause elevation there, their rotations cancel, so we don't get superior or inferior rotation. Now, what else do we get though? Let's just say we contracted those two muscles. We had levator scapulae and superior head of trapezius. Everything I just said would happen, but what else would also happen? We would still have that horizontal component of the superior head of trapezius pulling this way, which means that you would also retract your scapulae. So the scapulae would move up like this, but they would also retract at the same time. So you tend to go up and in a little bit like that. The scapula is not going to rotate, but it would still elevate and retract a little bit. If you didn't want it to retract, then we would need to contract another muscle in addition to those two that would cause protraction of the scapula, and then we would get another neutralization, right? Superior head of trapezius would try to retract the scapula, and then another muscle that does protraction would cancel that out or neutralize it. Right? So when we do movements, even something simple like shrugging your shoulders up does require multiple muscles working in coordination with each other to give you that coordinated movement. Okay, so that takes care of that. If you have questions about the rotations and everything, rewatch this part a couple times. If you still have questions, again, come on to a help session later on, and I can demonstrate it a little bit and talk about it. All right, so let's get this out of the way. So let's move trapezius out of the way. Now let's get the rhomboid major and minor out of the way. We got those out. And you know what? I lied again. Sorry. I'm sorry. I promise that'll be the next thing. Let's do the muscle that does protraction now. Since we just looked at the ones that do retraction and move the scapula this way, let's look at the muscle that we can see on the back that's going to move the scapula this way, which is going to be protraction. All right, that muscle is going to be called serratus anterior. Serratus anterior. All right, and to find this one, we're going to go to the other side of the scapula. So we saw the ones that do retraction, right? They're located from the scapula over towards the spine in here. To get ones that go this way, we need ones that are pulling on the scapula like this, right? We need to move it in this direction. And that's going to be this muscle here that I'm grabbing, right? See this guy right here? And look at what happens. I'm just going to move the scapula that way and look at how that muscle tightens up. Watch right here. See as I move it like there? See how that tightens up? And how if this one pulled like this, it would move the scapula that way. So let's just get trapezius out of the way because I want you to see something here. Look at rhomboids, right? There's rhomboid major. And look at serratus anterior. And notice how they are pulling in opposite directions here, right? Rhomboids, if the rhomboid's contracted, they're going to pull this way. And if serratus anterior contracted, see, it's going to pull the other way. So you can see how they're located kind of 180 degrees from each other, pulling in opposite directions. They're like this, right? So that means what's the relationship between rhomboids and serratus anterior? Well, when their lines of action are pulling in 180 degrees from each other, opposite directions, then we go, well, their relationship is antagonistic. They oppose each other. All right? Rhomboids do retraction of the scapula. Serratus anterior does protraction of the scapula, pulling it the other way. So you can't see the other attachment point for serratus anterior. This muscle actually, even though it looks like it stops right here, it doesn't. This muscle passes under. So watch my finger. I'm going to follow up that muscle and watch as I come up. See how I'm going under the scapula there, right? So serratus anterior goes under the scapula and still attaches to the medial border of the scapula by passing underneath of it, right? So it's pulling on the medial border this way. And then this muscle wraps around your rib cage. So you can see the ribs right here. Here's a rib here, 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 here. This muscle is going to wrap around the ribs and attach to the ribs a little bit more anteriorly. So we're going to see this muscle again when we flip the body over on the anterior side. I will show it to you again, and we'll see the anterior attachment point. So right now we can kind of see how it's going to attach to the scapula. We will see how it attaches to the ribs a little bit later on. But in order to visualize the movement, it doesn't really matter. We can see that it's going to pull on the scapula this way. All right. So that would be your protractor there. All right. So that takes care of everything that's going to move the scapula around. We got trapezius, we got rhomboid major and minor, right? We got levator scapulae, and we got serratus anterior. Those are all of your major scapular movers, at least the ones we can see on this side. There is another mover of the scapula on the anterior side, but we'll talk about that one at another time. All right. So now that we got these, now let's get the stuff out of the way. So we got trapezius out of the way. Let's take rhomboid major minor out of the way. Next thing we're going to look at are the rib movers, ones that move the ribs around. And we have two major muscles on this side that are going to operate your rib cage. And those are going to be serratus posterior superior and serratus posterior inferior. And you go, wait a second. We just did a serratus anterior. Right? Now we have these serratus posterior muscles. Notice that you have those extra terms on there. So if we just called them serratus, there'd be no way to differentiate. So we have a serratus anterior here, because that one goes more around the anterior side of your body. And then we have two serratus posterior muscles, here and down here. Okay. How do we differentiate between the two serratus posterior muscles? We add another descriptive term on the end, and that would be serratus posterior superior, this one, which is located more superiorly, and serratus posterior inferior, this guy down here, which is located more inferiorly. All right. And I'm going to move the camera down so you'll be able to see a better picture of that in a second. But let's look at this guy first. Serratus posterior superior, right here. Right. Attachment points for this one is going to be spinous processes of your upper thoracic and lower cervical vertebrae. Going this way, because we can see the muscles oriented like this, attaching to the ribs. Right? So we're going from the spinous processes of the vertebrae down to the ribs there. Now this muscle actually passes underneath of the scapula a little bit. See, it's underneath there. That's where it attaches to the ribs. So you can't really see the end of the muscle because the scapula is covering it, but it may be a little bit farther. It ends like right around here. All right, so about that far. From here down to there, underneath the scapula. And this one, what's it going to do? It's going to pull this way, right? Because again, what's more movable, your ribs or your spine? And in that case, ribs. All right, spine is pretty much your least movable thing. All right, so here we're going to pull the ribs towards the spine this way. And what does that do? That is going to lift the rib cage. Think about your ribs being like bucket handles, right? And I kind of demonstrated this in that first lab last time when we talked about the movements. Right now, if you're sitting down with your elbows at your side, take your hands and just touch your clavicle, touch your collarbone, right? Or as close as you can get to that. Maybe touch like the upper middle portion of your chest if you can grab there, right? And with your hands in those positions, raise your elbows out to the side. And notice that your arms now are like bucket handles, all right? That's what the ribs are like. So when you're in that position and your elbows are at your side, okay, your ribs are depressed. As you raise your elbows out to the side, if that's what your ribs were doing, if your ribs were moving superiorly and laterally, up and out, that would be when you expand the rib cage. That would be elevation of the ribs. Right? So the ribs can only move in two directions. They can go up, that would be elevation, and they can go down, that would be depression. And you can kind of see here, if we look at the ribs, right, that their natural position is to be a little bit down, right, in that depressed position. And they would swing up when we inhale, elevation, and then they would come back down into that depressed position when we exhale. All right. So since this muscle is oriented this way and it's going to pull like this, serratus posterior superior is going to assist with elevation of the ribs when you inhale. Expand the rib cage, serratus posterior superior. The other muscle, let's just move down, touch here, so we can see. Now we're down in the lower back, right? We got this guy, right? And look at the orientation of this one. And we can see it right here. It's going to go from spinous processes of lumbar vertebrae over, and we can see it attach right here. See how it attaches right along that rib there. And this one is going to pull the rib like this. And see how that's going to lower the bucket handle. We're going to pull the ribs down. This one would do depression of the rib cage. So let's just see if we can move up, and let's get them both on screen for a second here. Kind of centered like that. And notice how if I use my hands and I arrange them along their lines of action, see how these are pulling in opposite directions, right? Elevation of the ribs, depression of the ribs. So again, when you have lines of action that are either 180 degrees or, in this case, let's bring these two together, right? See how my fingers are? Let's bring them closer together. See how they're perpendicular to each other? Okay? That's also illustrates an antagonistic relationship. So when lines of action are 180 degrees from each other or perpendicular to each other, antagonistic. If lines of action are parallel to each other, like rhomboid major and minor, where they're going in the same direction, right, and they pull parallel, synergistic. All right, that's just a real quick way that you can tell. Now, in order for them to have that synergistic or antagonistic relationship, though, do note that they need to move the same things, okay? If you have two muscles that are oriented perpendicular to each other, but they're attached to entirely different things, then they're functionally not related at all, right? They're only related to each other when they're moving the same thing. So even though these muscles are separated a little bit, they're pulling on the ribs. So they're attached to similar things, right? Which means they are functionally related. But let's just say this one, instead of attaching to the rib, attached to the scapula. This one attached to the ribs and that one attached to the scapula, and they were oriented this way. They wouldn't have any relationship at all because one would move the ribs and the other would move the scapula, so they're functionally unrelated. But the fact that both of these are moving the ribs, even though they're spread apart, they're antagonistic to each other because they're moving similar things. Just kind of keep that in mind. All right. So we got those two muscles. Now, the other thing you want to note, is that these muscles here are involved pretty much only with heavy exercise, at least in normal circumstances. They're also involved with distressed breathing. So let's say you were having an asthma attack, right? And you're really just trying to elevate those ribs as much as possible because your body is just desperately trying to pull in air. Then these muscles are gonna work. But normal circumstances, no pathologies, no problems going on, then these muscles are really only activated to any significant degree during heavy exercise, when you're really breathing in and out fast and deep. Okay, so normal, you just go for a stroll, you're not really using these muscles. But if we started running, and we started sprinting, right, and you really started breathing hard, maybe you start hyperventilating, then these muscles are really going to be activating to lift and pull down the ribs, and lift them up and pull them down, right? But these are more exercise respiratory muscles, these guys. All right. The next, now that we're done with the ones that move the ribs on this side, we're going to get these guys out of the way. So let's move serratus posterior superior out of the way, and let's also move serratus posterior inferior out of the way. We'll see if this guy will stay. I might have to hold it in place here for a second. Now we're going to talk about some muscles that move the spine. All right. So I'm going to move the camera back up a little bit now. So let's go back up here, and let's just zoom in a little bit like this. All right. So we're up here. Whoops. And let's get serratus posterior superior out of the way. So we're up here on the back of the neck on the left-hand side here. And we're going to start with these muscles right here. And I've detached them, so I'm just going to lift these guys up a little bit so we can see which ones I'm talking about. So you see these muscles that are right here. All right, these are the ones we're going to start with. And these are your capitis and splenius cervicis muscles. So we have two muscles that are side by side, splenius capitis, splenius cervicis. And here, this right here, this bit that I'm moving here, that's splenius capitis. And this bit that I'm moving right there, that's splenius cervicis. So again, notice that I separated these muscles here, right? You can see the separation there. But then notice down here that they are still kind of attached to each other. And that's normal. These two muscles are pretty much stuck together and they run parallel to each other. So we can really see that the line of action for these muscles, and let's just grab a probe here, are going to be this way, right? Splenius cervicis would be this part, the lower part here. Splenius capitis would be this upper part here. So again, I'm just going to kind of outline them. Here, that's capitis, right? And then here, down there, that's cervicis. Splenius capitis, splenius cervicis. And again, they're parallel to each other, kind of side by side. So if I was going to ask this, just so you guys know on the practical, I would grab this and say, okay, see here, we have two muscles here. We have two muscles here, side by side. Like this, I want to know the one that's more inferior. I want to know the one that's more superior. You know, or I would say, here we have two muscles, 1, 2. I want you to identify the first one or the second one, right? I would do it something like that so you could really see the difference, and you know, I would show it to you so you know which one's which, right? Instead of just saying, what's this muscle right here? You know, where I'm kind of like close to the middle of it, you're not really sure what I'm pointing to. I would always kind of outline it, tell you there's two things right next to each other, you know, and I want the first one or the second one. So just so you know, I try to make the questions as clear as possible. Doesn't mean that you're going to get the answer right, but most of the time, when you get something wrong and then you see what the answer was, you'll be like, oh yeah, okay, totally get it. You know, it's not going to be like, oh, come on, what you were pointing at wasn't anywhere near what that was, or it was confusing. I really, really, really go out of my way to not make it confusing. I want it to be like if you kind of know where you are and what could be in that area, once I describe the question, you should go, oh, got it, totally. You know, I really do try to give you the answer as much as I possibly can as we're going through stuff. All right, so we got those two, splenius capitis, splenius cervicis here, right? Now, again, these are ones that move the spine. Now, look at the name, capitis cervicis. Capitis, when you think about that, capital has to do with the skull. All right, so this one, splenius capitis, is going from the spinous processes of these cervical vertebrae up to the skull here. And we're going to be attaching over here on the occipital bone of the skull. All right. Splenius cervicis is going from spinous processes of some of these upper thoracic vertebrae over, and this muscle is wrapping around to the side of your neck, and it's going to attach to transverse processes of your cervical vertebrae, which means we're going from one part of the spine to another part of the spine, right? A lot of the spinal muscles do that, right? They might go from one part of the spine to another part, or spine to the head, or some of these go from the spine to the ribs, right? There's some different things here, all right? But these two spinous processes either up to transverse processes of cervical vertebrae or up to the occipital bone on the back of the skull. So these muscles are going to pull like this way. All right, and the ones on the other side would be oriented in the opposite direction and would go like that. So these muscles make a V like that. They're oriented like a V on the back of your head and your neck, and they pull like that. All right. When we talk about spinal muscles, there's two different ways these muscles can contract, and we only really need to worry about this when we talk about spinal muscles. And that's going to be whether we're going to have a bilateral contraction or a unilateral contraction. Bilateral or unilateral, all right? Bilateral contractions mean that we're looking at the left-hand muscles here, right? But we know that there's another pair of these muscles over here on the right-hand side of the body, right? There's a mirror image of it on the other side. Bilateral contraction would mean that both the right and the left ones are contracting simultaneously like this. That's a bilateral contraction. Unilateral contraction means that only the ones on the left or only the ones on the right contract, independent of the other side. That's a unilateral contraction. All right. Now, in everything else that we talked about so far, things that move the scapula around, things that move the ribs around, we don't really care if it's bilateral or unilateral because it doesn't change the movement. But spinal muscles, we do care whether it's bilateral or unilateral because it's going to give us a completely different set of movements. Think about it this way, right? Right now, shrug both of your shoulders at the same time. Just elevate both of your shoulders. And both of your scapulae go up. They do elevation. Now just shrug one of your shoulders and leave the other one alone. Well, if you lift it up on the left-hand side, then your left scapula elevated. If you lift it up on the right-hand side, your right scapula elevated. But notice that the movement didn't change, right? We either did elevation of both sides or we only elevated one or the other side. It didn't materially change the movement. But with spinal muscles, if we have a bilateral contraction, it gives us this set of movements. If we have unilateral contractions, it gives us an entirely different set of movements. So it's very important to note whether we're going to do bilateral or unilateral. In fact, anytime you hear me say that we have muscles, and I want to know what happens if we have a bilateral contraction, I want to know what happens if we have a unilateral contraction, you're going to go, oh, this must be spinal muscle questions, because that's the only time we care about it. All right? So, looking on these, let's look at bilateral contractions first. So if we had splenius capitis and splenius cervicis on this side contract, and on the other side contract at the same time. So I'm going to grab the head and I'm going to grab the neck and I'm going to pull both sides at the same time like that. What's going to happen? The head and the neck are going to go back like this. And look at how the muscle loosens up. And you can see the same thing, even though I haven't dissected the muscles on this side. Look at how this loosens here. See how that tissue loosens when I move the head back like that, right? That's going to be extension or hyperextension of the skull and of the cervical vertebrae. That's what we get. Bilateral contraction of splenius capitis and cervicis gives us extension or hyperextension of the head and of the neck. Now, which one moves the head? Capitis, because it's attached to the skull. Which one moves the neck? Cervicis, because it's attached to the cervical vertebrae. But pretty much those muscles are going to co-contract simultaneously all the time, every time. Right? So we're pretty much always going to use splenius capitis and splenius cervicis together. It's possible to use one and not the other, but in most of our movements, the vast majority of the time, you're moving your head and your neck around. You're using both splenius capitis and splenius cervicis at the same time. Right? So again, bilateral contraction, we get extension or hyperextension of the head and of the neck. Right? Unilateral contraction. Just going to pull on this side, or I'm just going to pull on that side. All right. Again, we get a different set of movements. So if you remember back to last week when I demonstrated spine movements, okay, we talked about movements occurring in the coronal plane and occurring in the horizontal plane. All right. So coronal plane movements were this. We're going to move the head and the neck and tilt it from one side to the other, right? That was lateral flexion, tilting it. And then the movements that occurred in the horizontal plane was the rotation. I'm going to turn the head, right, from side to side. So lateral flexion, tilting of the head one way or the other, which is going to be moving the head and the neck this way or moving the head and the neck that way. And rotation, turning the head and the neck one way or the other, right? Those two movements are always the result of unilateral contractions. So the only way we get lateral flexion, kind of tilting your spine and your head one way or the other, or rotation, turning the spine and the head one way or the other, the only way we get that is from unilateral contractions. That's the only way. Bilateral contractions, like we said, right? They give us movement in the sagittal plane. Unilateral contractions of spinal muscles give us movements in the other two planes, the coronal plane and the horizontal plane. All right, so how do we demonstrate this? So we orient ourselves in line with the muscle. So we can see these muscles, line of action is going this direction. Again, I'll just kind of lay the probe on the muscle like this. Line of action is going like that, right? And we go, well, we don't have names for oblique lines of action, so we have to break that into its primary components. And that's going to be like this. Let me see. Let me do it this way. Sorry. Change my hand direction like this, right? Like that. So when we pull vertically down and horizontally, medially like that, like this, then that gives us that oblique line of action, right? So let's look here. Here, here. So pulling down is going to be is if I grab the ear right there and I pull the ear like this. Watch what happens. That's where I tilt the head. See that? That's the vertical component. Tilting the head. That's lateral flexion. Horizontal component would be like me grabbing the ear here like this. I can't do this, I don't think, and do it at the same time. No. If I grab the ear like this, what happens? I turn the head that way. See? If I did this, grab the ear right there, and I pull it this way, like that. That would be rotation. All right? So you see how the two components here, the vertical component is going to give me that lateral flexion. The horizontal component is going to give me that rotation. All right? That's kind of how it works. Now, last thing we want to think about here is which way are we laterally flexing and which way are we rotating? We did do this last time. So this is where sometimes when we talk about some of these concepts, you might want to go back to last week's recording and watch where I was demonstrating movements in the beginning. And I kind of talked about this a little bit, right? And this is the concept of same side versus opposite side movements. All right, hopefully that sounds a little familiar. Watch what happens here. That vertical component, if I grab the ear and I pull the ear straight down and the head goes like this, right? Notice that right now I'm on the left-hand side of the body. So we're talking about left splenius capitis or left splenius cervicis, vertical component, pulling like this. And which way does the head tilt? Towards me, to the left, all right? So I'm on the left, head tilts to the left, same side lateral flexion. Now, note that lateral flexion, by definition, always goes to the same side. So if I wanted to laterally flex the head the other way, I would need muscles on the other side of the body, right? So if I had these guys over here pulling this way, vertical component like that, if I grabbed the ear here and I pulled down on it, right, then the head would go the other way. But now I'm on the right-hand side and the head would be going to the right. It's still same side. Right? So if I'm on the left and we go to the left, I'm going to the same side. That's lateral flexion. If I'm on the right and I go to the right, that's same side. That's lateral flexion. So lateral flexion always goes towards the side that is contracting, either to the left or to the right. All right. Rotation, though, doesn't always work that way. Rotation can be to the same side or to the opposite side. So let's look here. If, again, the horizontal component is going to pull this way, right? So, and I'm just using the ear as an example because we can see it. So if I just grab the ear and I pull it like this, right? Head's going to turn this way, like that, right? Now we go, well, the muscle is on the left-hand side. So I'm on the left, I'm grabbing the left ear, and I'm pulling the left ear this way. Which way is the face of the cadaver going? To the left. It's turning towards the side that we're on, right? We're on the left, and that muscle contracts this way, and it turns the face to the left. That is a same side rotation. Same side rotation. I'm on the left and the face turns to the left, right? Opposite side rotation would be if I was on the left and when the muscle contracted, turn the face to the right instead. That would be an opposite side rotation. And that occurs when the muscle is oriented the other way, right? So look at splenius capitis and cervicis, and they're oriented this way. But if we had a muscle on the back that was oriented this way instead, right? Look at that. Look at the difference between me pulling like this and me pulling like this. In both of those cases, the vertical component is still pulling down, which means we're going to laterally flex towards me. But notice how now the horizontal component would be going in different directions. This one has a horizontal component going this way. This one has a horizontal component going this way now. And watch what happens here. If I have a muscle that pulls like this, instead of the ear as our reference point, look at what I'm pulling on. I'm pulling on right in the middle of the back of my head, right? So if I grab that little knob, right now, just feel around the back of your head. Go right down to the top of your neck, back of your head, kind of move up and down. You'll feel a bony lump sticking out right in the middle of the back of your head, all right? That's called your external occipital protuberance. All right, that's on that osteology lab that you guys got last time, or that hopefully you've started to review at least a little bit from last time. That external occipital protuberance, that knob on the back of your head, if I grabbed that knob and I pulled it this way, like this, I'm on the left, but if I grabbed that knob and pulled, what would happen? The head would turn like this. It would turn to the right instead. You can see here's that external protuberance. Which way it's moving? That way, right? Like that, but the face is going that way. See, that would be an opposite side rotation. So it's based upon the orientation of these muscles. Muscles that are oriented like splenius capitis and splenius cervicis that are going this way, those are same side rotators. Muscles that are oriented this way, though, anywhere along the back, those would be opposite side rotators. And just so happens that we have one right here. Look at this. So here's splenius capitis, but look at laying on top of it right here. Sorry if I can grab this, and there we go. See this guy? See, I move this out of the way. There's the rest of splenius capitis. But see how there's another muscle laying on top of it right there? And look at what direction that muscle's going in. This way. See? Here. This muscle is one that we're going to see again. We're going to name it now, but note that we will follow this one more when we get to the anterior side. But this muscle here is called sternocleidomastoid. Sternocleidomastoid. Long name. Okay, and we're going to re-mention this one. What I want you to get from this right now is notice how it is oriented completely opposite from splenius capitis. See, those fibers going this way. So when this muscle pulls like this, right, we still get that lateral flexion from the horizontal component, but the vertical component, but the horizontal component now is pulling like this. This one is an opposite side rotator. So this guy is a same side rotator. This one, opposite side rotator. Both of those muscles are located on the left-hand side, but this one makes the face turn to the left. This one makes the face turn to the right. Okay? So, again, when I'm saying same and opposite, when you answer those questions on the practical, you are going to substitute rights and lefts. And if a muscle does same side rotation, you're going to go, oh, what side of the body are we on? Okay, we're on the left-hand side of the body because that's where I'm standing, and I will always tell you what side of the body we're on. And I go, oh, that muscle does same side. That means it turns things to the left. If I'm standing on the left-hand side of the body and we're looking at a muscle that does opposite side rotation, you're going to go, oh, that means it turns things to the right. All right, so again, you're going to put rights and lefts on top of same and opposite so you know which way you're going to go. And again, these are, from what we're doing right now, these are the most complicated concepts that we have, all right? This is the hardest one for people to get straight most of the time. So if you're having trouble with this, you're not alone. A lot of people have trouble with this particular thing. Even people that understand movements well still sometimes have trouble with this, right? So definitely come on to a help session if the way I just presented it doesn't make sense to you. Come on to a help session so we can talk about it, because it's really, really important. You'll save yourself a lot of time and trouble to really get this concept down now and then be able to apply it to all the muscles rather than just go, I'll just memorize it and get by that way. That you're going to have trouble. So this is something that is important to understand, and definitely come on to a help session if you're not sure. All right? Okay, so that takes care of that. Now, let's move down a little bit. So we got splenius capitis and cervicis. We kind of just mentioned sternocleidomastoid. We're going to come back to this one because this one wraps around to the anterior side of the neck. So when we flip the body over, we're going to talk about sternocleidomastoid again. All right? We're going to be aware of this picture that we just saw. See it again from the front. All right, so we'll come back to that. Now, we're going to move down, and the next group of muscles we're going to talk about are your erector spinae muscles. Erector spinae. So we'll put that name up there. And that is a name of a group of muscles. Not individual muscles, a group of muscles. So think of the term, and, even though you guys might not have heard of erector spinae, right? You've probably heard of your quadriceps. You've probably heard of your hamstrings. Something like that. Those terms probably make sense a little bit, right? Those are also names of groups of muscles, not individual muscles. So sometimes we give groups of muscles a name when they have similar function. And that's the case here with erector spinae muscles. All right. So let's figure out where they are. So we're looking right now, we kind of shifted down a little bit, so we're kind of in like the thoracic region. How do we know? Because we can see the ribs here, right? So if we can see all the ribs, we can see them here, we know we're in the thoracic region, right? And look right here. Here's the spinous processes, right, of the vertebrae. And we follow it out, and notice how we have a bunch of stuff that looks like it's going up and down, up and down, up and down, until we get to right here. So you see from here to there, right? Everybody should be able to see that area in here. That's where the erector spinae muscles are. And we have three muscles that are side by side, three columns of muscles that are present on this side of the spine, like this, and also we'll have another three on the other side. Right now we're just looking at the left-hand side. And notice how I'm like laying my fingers across there. That is going to represent the three muscles here. So for the erector spinae, the three are going to be spinalis, longissimus, iliocostalis, those three. And if you want to think of it, if we move towards the spine, I love spine, right? Iliocostalis, longissimus, spinalis, like that. So we have three muscles side by side. Now you look at this and you go, wait a second. Looking right here, how in the world are you supposed to tell the difference between those three muscles there, right? And if I leave the fascia, so notice, just look here, so you can get underneath the fascia. See what I'm under there? All that fascia. You can see we can kind of push the probe there underneath. If the fascia is intact like it is here, then looking at it like this, there is no way that you're going to be able to see where the difference from one muscle to the next is. You're not going to be able to. So how am I going to ask it to you? I'm going to say, okay, in this area right here, I would kind of outline it. In this area, we have three muscles, kind of like this. 1, 2, 3. I want you to identify the first one, or the second one, or the third one. That's how I do it. So you're going to go, oh, I know we're looking at erector spinae. Which one does he want? Which one does he want there? Right? I want you to identify this one. You go, oh, that's the third one over. That's iliocostalis, longissimus, spinalis. Right? So you're going to know that those three are grouped together. I'm going to show you which one I want you to identify. That's how you're going to do it. Right? At least here, if the fascia is intact, you're not going to be able to see the difference. But let's slide down a little bit. All right, and here you can see where I peeled the fascia off, this area. Now, normally this spot would be covered by this muscle. That was your serratus posterior inferior. So we're going to reflect serratus posterior inferior and expose these erector spinae here. And again, I've cut off the fascia here so we can actually see the muscle. Now, look at how we can just create a little space. See my finger here? That means that out here, this is iliocostalis, right? And then here, see this bit that we can move around right here? That's longissimus. We move that out of the way. And then this bit that you see coming down right there, that's spinalis. Okay, so here with the fascia out, we can separate those muscles again. You can see 1, 2, 3. Spinalis, longissimus, iliocostalis. All right, so either way, I could ask it up here or I could ask it down there. It depends, and you should be able to tell the difference either way. So let's just move back up just a touch here. All right, so looking at these muscles, let's start with iliocostalis and longissimus. And notice that if we put the probe on here in line with these muscles, that they are slightly oriented this way a little bit, right? They're not straight up and down. You can see the spine here. These muscles, as we move up, get further from the spine. Notice how I'm like, see where I am here? And if we follow this muscle, like we're that close to the spine, we follow this one up, 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 and we come out over here, and now we're that far from the spine, right? So it's slight, but they're angled this way a little bit. And we can kind of see, here's the upper bit of iliocostalis, and here's where longissimus is starting to become tendinous. And see how it's a little bit more medial there, right? But they're oriented this way. So even though it's not as steep of an angle, let's just move up a little bit again and look at Splenius, capitis, and cervicis, right? And they were going in this direction. These muscles are oriented the same way, just on a less of an angle. Okay, these guys are a little bit more like this. The ones down here are just a little bit more like that. So a little less of an angle, but still in the same direction. All right, so that means that these muscles, if they contracted on both sides of the body, Bilateral contraction, what are they going to give us? Extension or hyperextension of the spine, just like splenius, capitis, and cervicis did. And they're going to operate whatever part of the spine we're talking about here. Look at how long this muscle is, right? It spans the lumbar region, it spans the thoracic region, and they actually continue up a little bit farther into the cervical region up there, right? So these muscles can operate all these parts of the spine. So if we're talking about what does this part do right here, and we're in the thoracic region, well, then it would be extension or hyperextension of the thoracic spine. I don't know what this part of the muscle does down here, and we're in the lumbar region, then it's extension or hyperextension of the lumbar spine. So you do want to specify what part of the spine we're talking about. And again, that's going to be depending on where we are. All right. So that would be bilateral. That would be both sides contracting simultaneously. Yeah. Unilateral contraction, only one side. This is going to be very similar to the muscles we saw up there, which were splenius capitis and splenius cervicis. If we have just this side contract like this, okay, that's going to be a combination of these two movements. And again, if I pull straight down only on this side, like this, spine bends this way. So lateral flexion to the same side. Again, I'm on the left, spine bends to the left. And here, if the rotation is going like this, see, I'm going to grab the ribs and I'm going to pull the ribs this way. I'm going to turn the body to face me. Right? Now, I was demonstrating with the head before, which is kind of why I started there, because I can move the head around well. I can't really turn the body without lifting the whole thing up, which unfortunately I'm not strong enough to do with full-size body here. So take my word for it. If I grab the ribs and I pull the ribs like this, body's going to turn and face us, which would be a same side rotation. And again, you want to look at which way are the components going. Vertically, we're pulling like this. Horizontally, like that, right? And again, that's going to have the body face towards us. So iliocostalis, longissimus, those are lateral flexors and same side rotators when we have a unilateral contraction. All right. What about spinalis? What about the third one? That one, and I know it's a little hard to see. You can see it right here. Notice how, see this part of the muscle? Looks like it's still oriented like this. But what happens? If we follow this farther up, it hooks back in and connects to another part of the spine. So this one is going from a spinous process up to another spinous process up here, where these ones down here are originating on spinous processes down here, and they're going out to the ribs. That's why they have that more lateral attachment point, right? But spinalis is going from spine to spine, spinous process, spinous process. That means that its line of action is perfectly straight up and down. It hugs the spine. All right. So this muscle does not have a horizontal component. It's only pulling in the vertical direction. There is no horizontal component there, which means that spinalis does not rotate the spine. All right. Iliocostalis and longissimus, they do rotate because they're angled like this. They do have a horizontal component, but spinalis, because it is straight up and down, no horizontal component, no rotation. All right. So if we have a unilateral contraction of spinalis, what do we get? Only lateral flexion, because it's only going to pull in that vertical direction and bend the spine one way or the other, no rotation. If we have a bilateral contraction, it'll be just like the other two. Pull on both sides of the spine at the same time, then we get extension or hyperextension of the spine. All right, so you're just going to put a little asterisk by spinalis and say that of those three erector spinae muscles, that spinalis, because it does not have a horizontal component to its line of action, does not give us rotation. All right, that takes care of the erector spinae muscles. Now, just note, and this is on the handouts, if you guys are following along on the handouts, you will see that collectively the erector spinae muscles span the entire spine. They go from the lumbar region all the way through the thoracic to the cervical and up to the capital regions, up to the skull, right? But you will note that one of the three is not present in the lumbar region and one of the three is not present in the capital region, right? And that's normal. So you're going to note that spinalis is not present down here in the lumbar region. So right where we see it here, this is the very end of spinalis, and it does not continue down in this region, right? Iliocostalis does not exist up in the capital region. It doesn't make it all the way up to the skull. All right. Longissimus, that one is present the whole way. You want to know the spinalis is absent here, and iliocostalis is absent all the way up at the top. All right, and it says that in your notes and in your handouts. Okay, just be aware of that. All right, so the next group of spinal muscles are going to be your spinal stabilizers. Spinal stabilizers. Okay, and these are deep to the erector spinae muscles. So we had 3 erector spinae muscles that were side by side here. And if we peel these off, take these off, underneath of this, we will have 3 more muscles, which are going to be your spinal stabilizer muscles. All right. And those are stacked on top of each other like this. All right. So you see how I have my 3 fingers like this, and I'm going to stack them up like this. So under these 3 muscles that are side by side, we have 3 that are stacked up, oriented like this. And those 3, from superficial to deep here, are going to be semispinalis, multifidus, rotatories. All right, so we have 3 muscles stacked up on top of each other. And again, the most superficial of the 3 is going to be semispinalis. Under that, multifidus. Under that, rotatories. Or you can just say rotators. Okay, and again, they're oriented like this. So without cutting this muscle completely off, it's going to be a little tough to see these, but there are 2 spots that we can kind of move this stuff out of the way to see the deeper muscles. And one of those spots is going to be right here. So let's move down a little farther, and I'm just going to zoom in, touch here, kind of like this. All right, so we're way down here in that lumbar region. And again, what did we move here? We got serratus posterior inferior that we moved out of the way so we can see the erector. Sorry, the camera's a little shaky there. So we can see the erector spinae muscles, iliocostalis, longissimus, spinalis. Now, I created a little space here, so we're going to take longissimus and we're going to move longissimus out of the way. See, like this. And you see these muscles, fibers that we expose, see? These guys right here. And notice those guys are going in this direction. So you see how these ones here are going this way, and this one, if we put it back in, see it's going like that. But the ones under it there, they are going like this. See, I'm right on top of them there. And that, what you're seeing right there in this area, is multifidus. This is multifidus here. But we said that that's not the first one, right? Because we said we should have 3 stacked on top of each other, and the most superficial one should be semispinalis. Why are we not seeing semispinalis? Why? Because the spinal stabilizers, the same thing that happened with the erector spinaes is that one of them is missing in the lumbar region, and one of them is missing all the way up in the capital region, right? Same thing, and that's normal. So in this region, which one's missing? The first one, which is semispinalis. So if we take semispinalis out because it's not present here, what's the first thing you're going to see? Multifidus, which is what we're seeing there. Okay. If we move up a little bit, so here's multifidus, multifidus, and then you see this tendinous part right here. You see how that's going. Look at this guy going this way. See this guy going like that, and you see how this one's going the other way there. That is the very bottom of semispinalis right there. Okay, and as we go up further, you would see more, but here's a little bit more of semispinalis there, right? You see how they're going that way. So multifidus down there, and then when you start seeing this would be semispinalis. And if we went further up, if we cut these muscles out of the way here, then we would have semispinalis, and then under that multifidus, and then under that rotatories. Now, again, if we cut multifidus out of the way here, under that rotatories, you would see it. We're not going to do that. So you can just see a little bit of multifidus there. So that's one spot where you can see a little bit of the deeper stuff. And then the other spot's going to be all the way up top, which we'll get to in a second. But what I want you to know is these muscles here, oriented this way, are going to pull like this, right? So unlike these guys that were oriented like a V like this, the deeper ones are oriented like an upside down V like this, right? So when they pull bilaterally, look at how it doesn't matter if bilaterally I pull like this or I pull like this. The vertical component is going in the same direction. It doesn't matter. I'm still pulling this way, which is going to give us extension or hyperextension of the spine. But the horizontal component is going to change now. So if I'm pulling like this, right, that is going to be like me pulling like this. See? This way is going to be equivalent to this. So I still have the vertical component, which is lateral flexion. And it's going to tilt the spine towards me. But now the horizontal component is pulling the other way. So what I'm going to do is grab the spine, and I'm going to move the spine this way, which that is going to turn the body to face away from me. And I'm going to demonstrate this up on the head. We did that before when we looked at sternocleidomastoid, right? When the horizontal component was going this way and I grabbed that knob on the back of the head, face turned and went away from me. So these are opposite side rotators. All right? So we got that. Let's move up a little bit here. And up here, what I'm going to do is take Splenius, Capitis, and Serratus, and I'm going to reflect those muscles. I'm going to get these guys out of the way. And what do I uncover here? This is semispinalis. This is where you can see a fair bit of semispinalis. And now I'm going to take semispinalis and I'm going to reflect this a little bit, like that. And under there, let's see, maybe I'll hook it with the probe here, like this. Let's move up just a little farther. Whoops. Sorry, I'll reposition the camera here. I'm just going to zoom in up like that, touch. Maybe I got to come in a little farther. There we go. That's better. All right, so here is semispinalis. And I'm going to take semispinalis and I'm going to move it out of the way a little bit. And look at what you see underneath there. There's multifidus. Okay? So we can see those two. In order to see those, we got to take Splenius, Capitis, and Serratus and reflect that. Semispinalis, and under that, multifidus. And then again, if we cut multifidus out of the way, underneath that would be rotatories. All right, so that's just another spot where you can see those muscles a little bit. All right. So that takes care of spinal muscles. So last thing we're going to do for today. Today's going to be just a touch shorter. All right. Next week's going to be a touch longer. And again, I'm just avoiding us having to flip the body this week. So next week we'll flip the body over. We're going to have a little bit more next week just to catch us up a touch. But we're going to take a couple minutes to really go over a couple more concepts with this movements. Now I'm going to show you some things on the body, then I'm also going to demonstrate them on myself. And I'm really hoping that this will kind of bring everything together. So let me just get a little bit more so we can kind of see both sides here. All right, like that. Okay, so we're looking at the back of the head. We can see both of the ears. We can see where the spine is here, right? We got those muscles and everything on both sides. So what we want to talk about is how all these spinal muscles work together to move our spine in the directions we want to move. All right. So remember when we said bilateral contraction. So if we had Splenius, Capitis, and Serratus on both sides, pulling at the same time, we said that's going to be extension or hyperextension of the spine. But why is that? Why? Because all of the other movements that these muscles are capable of doing are going to neutralize each other, right? So think about this. If we have Splenius, Capitis, and Serratus on the left-hand side doing their unilateral movements, right? So just the side pulls, and that was, again, going to be lateral flexion and same side lateral rotation, okay? If the muscles on this side do the same exact thing, they're going to try to laterally flex this way and rotate that way, right? What happens to the lateral flexions and the rotations? They cancel each other, right? If at the same exact time, and think about moving your ears. If I pulled on the bottom of this ear and the bottom of that ear at the same time, and I pulled both ears down simultaneously, the head's not going to bend either way. It's just going to stay right where it is, right? Why? Because the lateral flexions neutralized each other. If I grab this ear and I pull it like this, and I grab that ear at the same time and I pull it like that, which would be the horizontal components, and they happen simultaneously, and we pull the ears like that, the head does not turn. Why? Because those rotations are neutralizing each other. And then what happens? we're still shortening these muscles. Well, if we can't bend the head this way or that way, and we can't turn the head this way or that way, the only other thing that the shortening of those muscles can do is move the head back. Right? That's just what we're left with. The only thing is the head's got to go this way because we can't turn it and we can't tilt it. It's just got to move back. Right? So those bilateral movements happen because the unilateral movements are neutralizing each other when the left hand and the right hand sides contract simultaneously. I hope that makes sense. Now, what happens when we do unilateral contractions? Okay? How do we only bend the spine? How do we only rotate? Because we know we can do those things, right? If splenius capitis and splenius surfaces contract on this side, okay, we are going to get lateral flexion and same side rotation at the same time. Because remember that muscles cannot pick and choose which movements they do. If we're only contracting these two muscles, we are going to get every single movement that those two muscles are capable of doing every time. So if we use splenius capitis and surfaces, we can't only have lateral flexion and we can't only have lateral rotation or rotation to the same side. We have to have both of those things. So the head is going to tilt and turn to this side simultaneously. It's going to do both of those things. How do we get it so we only do one or the other? And that's going to be getting cooperation between muscles on this side of my body and muscles on that side of my body. All right, so look at it this way. If we want to do lateral flexion of the spine, so I want to bend the head this way. I do not want to turn it. All right, that means that I have to have multiple muscles on the left-hand side of my body contract at the same time. So let's just say I had splenius capitis contract. That one, pulling like this, is going to do lateral flexion and same side rotation. But what happens at the same time that one contracted, I contracted something like sternocleidomastoid, right? Going in that opposite direction. This sternocleidomastoid is still going to do lateral flexion, but sternocleidomastoid is going to do opposite side rotation. Well, if this one is doing same side rotation, and this one is doing opposite side rotation, the rotations neutralize, but we're left with the one thing that they both do the same, which is lateral flexion, right? So we need muscles that on the same side of the body, both on the left-hand side, that are oriented in opposite directions like this, so that when they pull, the rotations neutralize, but the vertical component is additive, right? And we get that lateral flexion this way. And if I wanted to laterally flex over here, then I would only have muscles on the left-hand side contract. I'm sorry, on the right-hand side. So if I want to laterally flex to the left, which is the side that I'm on, multiple muscles on the left side. Can I have anything on the right side contract? No. Because the second I contract a right side muscle, then it's going to want to laterally flex to the right, which means the lateral flexion would neutralize and we wouldn't be able to do it, right? So if I want to do lateral flexion, it's going to be multiple muscles on that side of the body. I'm on the left, I need multiple muscles on the left side to contract at the same time and 0 muscles on the right side of the body to contract. If I want to laterally flex to the right, then I need multiple muscles on the right side and 0 muscles on the left side. And that's how we get lateral flexion. What about rotation? All right. If I want to rotate the body to the left side, I want the body to face me on the left. Okay. Well, that means I need a same side rotator on the left-hand side. So something like splenius capitis or splenius cervicis pulling this way, where the horizontal component is going in this direction, turns the face towards me. These are same side rotators. So I want a same side rotator on the left, but at the same time, I want an opposite side rotator on the right. So if I had splenius capitis and cervicis on the left, contracting at the same time as sternocleidomastoid over here on the right side, right? Look at what happens here. On this side of the body, can you see my fingers there? Yeah. Yeah, on this side of the body, sternocleidomastoid's going, let me use this hand. Sternocleidomastoid's pulling this way. Splenius capitis and cervicis are pulling this way. Look at how they are going to work together, right? This side is an opposite side rotator, which means the face wants to go that way. This side is a same side rotator, which also means the face wants to go that way. And you see how they would work together and the face would go that way, right? So an opposite side rotator on the right-hand side, along with the same side rotator on the left-hand side, they work together and the face goes that way. If I want to go the other way, well, then it would be like this, right? I would have sternocleidomastoid on this side, working with Splenius, capitis, and cervicis on this side, and notice how they're going, see how they're going to go in the same direction. So I have here a left-hand muscle, that's an opposite side rotator, working with right-hand muscles that are same side rotators, and then I would go that way. So hopefully that works, and that's where you really want to use your fingers. So we go, wait, this muscle and this muscle, their lines of action are actually going in the same direction because we've crossed the body, right? The left-hand one and the right-hand one go in the same way. They will work together. So when we want to rotate, it's going to be muscles on the left-hand side and the right-hand side, but they cannot be the same muscle. That's the key. When you want to rotate, we can't have a right and a left-hand version of the same muscle contract at the same time. Why? Because then the rotations would neutralize. But we can have right and left-hand muscles contract as long as they are different muscles. Then the rotations can work together. All right. And again, if we want extension or hyperextension, then we're going to have bilateral contractions. And then it's going to be, when we say bilateral, we mean, well, it's the muscle, the right hand and the left hand version of the same muscle contract. Then we get the extension or hyperextension. So you see how we pair things together differently when we're talking about spinal muscles to give us different movements. So I'm going to put the camera on myself, and we're just going to go through another example. I'm going to show you the same thing. We're going to name muscles that can perform these things. And again, you want to go through this exercise a couple of times and do it on yourself and try to visualize these muscles contracting and how they will work, right? And that'll be the last thing that we'll do for today. And again, I know today's a little bit shorter. That's okay, because you really want to go back, take this extra time to make sure you go back and look at that intro video if you did not do it. Make sure you go and start the osteology video if you didn't do it. And really pay attention to these movements that we talked about and try to make sense of them. And then come on for a help session if you need help. Get all of that conceptual stuff done. Then everything from here on out will be a bit easier if you do that. So take the little bit extra time, make sure that you do go over all of that stuff. So let's see if we can get the camera on me for a second. And I'm going to do something like this. Let's see how this is. Is that too far down? Or yeah, let's just tilt this up a touch. And just so you can see, there's Alex sitting over there helping you guys out. Let's get that there. All right, is that a little bit better? Yeah, now we can see. Okay, just give me 1 second. I'm just going to cover up the body so it doesn't get too dry while we're doing this part. And I'm just going to take my gloves off, and then we'll kind of hit these couple things. All right, so let me get my outer layer of gloves off here. All right, so now let's kind of demonstrate some of these movements and talk about them. So if I'm in anatomical position, right? And if I said, all right, I'm starting in this position, I want you to name this movement. Start here, end here, right? And then I might go to the side, and I would show it to you from the side and say, okay, start here, end here, like that. And I want you to name the movement. Start here, end there. And what you're going to say is that movement that I just showed you is hyperextension of the lumbar spine. That's where we're moving there. When you see my rib cage kind of tilt up like this, I'm contracting in the lumbar region to lift the rib cage there, right? So that's going to be hyperextension of the lumbar spine. If I wanted to do regular extension, I'd start in a different position. Instead, I would say starting here, like this, and here, right? Start here, end there. That would be extension of the lumbar spine. What I was showing you was hyperextension. It doesn't really matter. So we'll say extension or hyperextension, right, of the lumbar spine. And I said, all right, based upon the movement that you just identified, I want you to name two muscles that when they work together perform that movement. And you go, okay, well, if I'm doing extension or hyperextension there, we need a bilateral contraction of spinal muscles, right? So if you have to name two, what are the two you're going to name? You're going to give me a right and a left-hand version of the same muscle. So you could say right and left spinalis would contract at the same time, would cause me to do hyperextension. Right and left longissimus, right and left iliocostalis, right and left semispinalis, multifidus, rotatories. Any bilateral contraction, which means when you're saying two muscles, it's a right-hand version of that muscle and a left-hand version of the muscle. But the key is you'd pick two of the same muscle, a right and a left of the same muscle would allow me to go back. And it doesn't matter which pair you did because all of my spinal muscles along the posterior side are going to do extension and hyperextension when they do a bilateral contraction, right? So that would be how you'd answer that question. So obviously there's lots of correct answers there. Let's say instead, I start here and I go, I want you to name this movement, right? Start here and here, right? Here to there, like that, right? And you go, okay, that was lateral flexion of the cervical spine because this was the only part of the spine I moved. Lateral flexion of the cervical spine. And here you're going to say, which way did I go? Now, note, right now the camera is reversing things, and that's fine. This is the left, this is the right. All right? So I will orient you guys when I do it, but because I know on your computer screen it's flipped, if you get your lefts and your rights mixed up, don't panic. I don't care. I just want your answer to correspond with the way you said I went, right? So if I start here and I do this, this is going to be lateral flexion of the cervical spine to the left. But if you said lateral flexion to the right, that's okay. I don't care. You just pick away, right? So this is lateral flexion of the cervical spine to the left. That's the movement. And I go, okay, name two muscles that when they work together perform that movement. And you go, okay, well, I got to think of where we are. We're in the cervical region, so I need muscles that are located in the cervical region, right? So I can pick Splenius capitis. And which Splenius capitis is going to make me tilt my head to the left? And you're going to go left Splenius capitis because it does same side rotation, right? So Splenius capitis on the left will cause my head to bend to the left. But what else is Splenius capitis going to do? It's also going to rotate. And it's going to rotate to the left as well. So if I only contracted Splenius capitis on the left-hand side, it's going to look like this. I'm going to laterally flex and rotate to the left. I'm going to do both of those things at the same time. I only want to do the lateral flexion. I do not want to do the rotation. So the second muscle that we pick is going to have to be one that gets rid of the rotation. So we need something that neutralizes the rotation, but adds to the lateral flexion. So in that case, I'd pick something like sternocleidomastoid on the left-hand side, right? That was the one we showed on the back there. The sternocleidomastoid on the left is still going to bend my head to the left, but sternocleidomastoid turns my head to the right, which looks like this. I bend my head this way, but I turn my head the other way like that. That would be sternocleidomastoid over here. So if we had Splenius capitis and sternocleidomastoid on the left-hand side contract simultaneously, both of them tilt my head. The one turns my head this way, the other one turns my head that way. What happens to those rotations? They neutralize each other. So that we get a neutralization, and then we get that part that adds together the synergistic part, which is the lateral flexion. That would be how you'd answer that. The two muscles you would say would be left Splenius capitis and left sternocleidomastoid. Then we get lateral flexion to the left. All right. Now, what if we want rotation? So again, I could start here, anatomical position, say, okay, name this movement. Start here and here. All right. Begin here and here, like that. And that is going to be rotation of the lumbar spine to the right. So I'm rotating my lumbar spine to the right-hand side. All right, that's the movement that I just showed. So it's here. And when I do that, if I was demonstrating that movement from here to here, I would say the movement's occurring in this region, because I would say I'm not doing this or anything like that. I'm not turning my cervical spine, only turning this part, right? So rotation of the lumbar spine to the right. So name two muscles that when they work together would perform that movement. And here is where you're going to go, well, I want to turn to the right. This is the way I want to go. So I need a same side rotator on the right side. And at the same time, I need an opposite side rotator on the left side. All right. So I want to turn to the right. So I could use something like right longissimus is a same side rotator. So a right hand longissimus will cause me to rotate this way. And at the same time, I'm going to use a left hand multifidus, because multifidus is an opposite side rotator. But if it's on the left, it makes me want to go to the right. So I use a same side rotator over here, like right side longissimus, and I use a opposite side rotator over here, like a left hand multifidus. Those two contract at the same time, and I go that way. Okay. Why do I only rotate though? Because the right hand one wants to turn me this way and tilt me this way. The left hand one wants to turn me that way, but it wants to tilt me this way. So the tilting, which is that lateral flexion, they neutralize, because they're both trying to happen. They neutralize, and we're left with the one thing that they both help each other with, which is rotation. So notice that when we are doing spinal movements, we are getting constant neutralizations. Something's neutralizing to allow something else to happen. That's just the way we pair things together. Now, we talked about muscles on the back here, right? In reality, you're also going to be using muscles on the front, like your abdominal muscles at the same time. We just haven't talked about them yet. When we get to the abdominal muscles, and we're talking about rotations and everything, we're then going to go back and go, remember the spinal muscles, how they help out. Then we're going to be able to pair these things together all the way around, right? And talk about how something here and here and here and here all work together to make me move one way or the other, right? And it gets more complicated as we add on more muscles, but the core concepts stay the same. If you can do it at the small level, if you can just pick two muscles, I want to know two muscles that work together to cause me to do a motion, and you understand it, you won't have any trouble layering on more muscles on top of that, because it's the same concept just applied again and again and again with different muscles, right? So you really got to understand it on that smaller level before you're going to get out to that macro level later on. Okay, was there something else that I wanted to do here? So we talked about that. Trying to think. I thought there was. Give me 1 second. I'm having complete blank here. If I don't think of it in a minute, we'll just say forget it. But I thought there was something else that popped in my head that I thought would be good to do here. I don't remember. All right. So we're going to end in just a second. So again, we're going to meet again on Wednesday. On Wednesday, body's going to be flipped over to the anterior side. So once out here, we're going to hit face. We're going to do all the face muscles. We're going to hit anterior neck muscles. And then hopefully we'll also get to some of the thoracic muscles as well. So we're really going to try to make a push and get almost all the muscles out of the way. So we can do all the movements and stuff. Then we will move into organ systems after that. So we can kind of be done with the vast majority of the muscles and mostly just have organ systems and vasculature to do, which I'm saying that's the bulk of what's going to be on the practical. It's a lot of stuff. So next time, face, anterior neck, a little bit of thoracic cavity, plus some of the structures in there, plus whatever osteology I can do, like I kind of did today. I'll bring over a bone. I'll kind of correspond parts. We'll maybe use the skeleton. Can they see the skeleton over there a little bit? It's kind of covered up a little bit, but over there, kind of wheel him over, and we'll show some stuff on that as well. That's kind of where we're going to go next week, on Wednesday. All right. So in the meantime, if you have extra time, watch that intro video if you didn't watch it. Start going over the osteology video. That's something that you want to spend a couple minutes on every class time, right? To just get through some of it so that by the time we get to the practical, you've done the whole thing. And then you've really paid attention to the parts of the osteology that I've highlighted on the body, because those are the things we're going to ask. All right, so you got that. And then also keep in mind, we will have a help session this afternoon. Come on to that or schedule a different one with me if you're having any trouble with some of the conceptual things that we went over, or identification things, doesn't matter. No question, or any question is good. Come on there, ask, get help. Don't let things that you're not sure of continue. Get them answered and fixed up now so that you'll be ready to start tackling more and more information as we go on. And note that after today, we've covered a lot of concepts. So I'm going to assume that you have spent some time on these concepts, and I'm not going to be so slow in describing things as we move forward because we just won't get through it, So I have to start picking up steam, and I try to bring you in gradually, right, and go over more and more stuff. But you will see that we will cover more and more and more and more as we go because I'm assuming that all the base concepts you have are good and sound. All right. So we'll stay on for a minute. If you have anything in the chat, go ahead and post it up. Otherwise, I will see you guys on the help session.